Welcome back. Well, according to a new study, acute heart attack symptoms often go unnoticed in women. And women do have heart attack symptoms, so they're vastly different, though, from men. So what can we learn from all of this to better protect ourselves and our loved ones? Well, we have Dr. Ali Kazryan here with us today, and we're going to ask you about this new study because this is really interesting. What have you found in the new study?
So it kind of goes, follows up on the same thing that we kind of talk about. Most men and women think about chest pain. With men, it's chest pain, chest pain, chest pain. And women, this study kind of verifies that for both men and women, chest pain is a predominant symptom that they notice with chest pain, with heart attacks. What this found was, especially in younger women, that women more often complain about other symptoms as well. And so where it can be misleading is that both their perception of what it may be and also their physician's perception of what it may be that's not heart related can be misleading, and everyone's perception of a heart attack, and that could potentially be very risky and dangerous.
Why is it so different, though? Sorry to interrupt, because we all have a heart. Everyone has a heart just like everyone else. So why would it be so different in men and women?
So think about it. So you're short of breath. You may have pain between your shoulder blades. You may feel nauseated. You may feel lightheaded. You may have a breaking out of kind of like a sweaty feeling. Those could be very non-specific. So they may not be the same as chest pain. The classic chest pain that people feel that's related to a heart attack is this tightness, this pressure. It's like an elephant sitting on your chest.
You always hear
that you always hear from that standpoint. So if that is not happening, and for all of us are in denial, no one wants to say that I'm having a heart attack. And again, with this study, they looked at people specifically, in adults less than the age of 55. So for those of us in that age bracket, 18 to 55 years of age, we're not thinking that we are, we still hope to be immortal and we're not having heart attacks.
Sure.
So if someone's 40, 42 years of age and you're a woman, you have not grown up thinking that you are going to die of a heart attack.
So how can we protect ourselves then? I mean, because that's the one thing, we can identify the symptoms, but how can we protect ourselves?
The big thing to be mindful of, just in a general aspect, is to try to decrease risk factors. Don't smoke, maintain a healthy lifestyle. Go to the doctor. But in terms of the most specific thing with regards to an application of this study, if you start noticing anything that may be at all related to a heart attack, one, obviously if you're having chest pain that's going up to the jaw, that's shooting up to the left arm, and you're noticing radiating pain, tingling in your hands.
And it's always the left side, right?
It can be, but you can have things going to the right side as well. And with women, be mindful of these non-chest pain related pain. And in this particular study, they found that 29% of women saw their doctor a week before. 22% of men saw their doctor a week before they actually went to the hospital with what ended up being a heart attack. 37% of men versus 53% of women. More than half of the women, their doctor did not attribute these symptoms to being a heart attack that ended up becoming a heart attack. So if they persist, if the pain doesn't go away, if these things, make sure that you go back. So if you're noticing these things, go to the doctor. Don't sit there and kind of just make sure that it's not, it's not anything. We try to minimize things that may be something of significance, and if they persist, go to the doctor. And when you're dealing with anything that has to do with the heart, have a short threshold. The other thing is, if you have underlying risk factors, you have diabetes, you have high blood pressure, you have previous heart attacks, if anything new persists, go to the doctor. The other thing that's interesting, another study recently came out that during the flu season, your risk of having a heart attack, in a Canadian study came out, is 6 times higher, especially if you have underlying cardiovascular disease of heart attacks, strokes, of having those things. So get your flu vaccine. That can potentially help.
So a flu vaccine could actually help prevent you from a heart attack.
Not just to not get the flu.
Males and females.
And males and females.
Okay.
So that can potentially be helpful. So do the things that can potentially prevent, but have a short threshold for going and seeing the doctor if you have anything that can potentially be related to your heart, especially if you're a young woman who's having something that is not right. If you're tired, if you're sluggish, and be mindful, because you could save your life.
That's great information. I love that. Okay. All right. Well, for more information on Dr. Kaz Ryan, you can head to Dr. Kaz Ryan's website, which is KazRyanUrology.com, or you can listen to him live and call into his radio show on The Conversation. It's on WOKV, and it airs every Saturday starting at 5 p.m.